My biggest priority for women's health is to improve their access to health care. It's a big thing in these rural communities because oftentimes they're very, very far away from their doctor. So we want to make sure that we can help them prioritize their health so that they don't put off seeing the doctor, getting their new prescription, getting refills.
The WISE Telehealth Network aims to improve women's health and well-being through telehealth appointments at local libraries and the mobile library in the rural Lowcountry. It may be surprising, but even here in Charleston County, the areas served by WISE are designated as rural areas by CMS. These areas are also medically underserved areas and designated as primary care health provider shortage areas. So seeing the need in this community, we wanted to go and talk with women in the rural Lowcountry about how to start a telehealth initiative. And so we conducted formative audience research to understand their perceptions of telehealth. We conducted 52 in-depth qualitative interviews with women in the rural Lowcountry, and they told us that they wanted a telehealth initiative at a neutral, established community location, at a public library.
Libraries are vibrant community hubs. I mean, we know that libraries aren't just book museums, that they are constantly evolving to meet the needs of their communities. For Charleston County Public Library, we offer summer feeding programs, after-school snack programs for kids and teens. We lend hotspots and Chromebooks for people who don't have reliable internet access. We are spread out across Charleston County. We have branches in rural areas, in urban areas. So it's a natural fit to take the mobile library and the branches we have and to offer telehealth. We want to make it as easy as possible to where a woman doesn't have to drive 30-40 minutes for a doctor's appointment, that she can come to her local library right in there in her community and get health resources and healthcare needs met.
We have a lot of women who are just walking in, returning their books, which I'm right next to, and I'm able to just kind of tell them, hey, have you heard about this program? And just tell them about the services we provide, ask them if they're interested in any of them, and usually the conversation goes from there.
I think one of the struggles that we all have as far as making doctor's appointments is time off of work, childcare, transportation. So I think for women living in rural areas, some of those issues might be amplified. So telehealth offers them access to a clinician to be able to answer their questions and address problems that, if it doesn't require a physical exam, is a very reasonable way to get care.
I basically just set them up in a private room with a computer. And that way they're able to speak with the doctor privately, and they can have me in there if they'd like, or they don't have to. After that appointment, it's really up to the provider and the patient as to what they want to do next. Scheduling another appointment, getting a referral, writing prescriptions, all that kind of stuff is going to be done between them too. And the doctor will let me know if they need to schedule another appointment, and I can do that with them right away.
One of the things that we struggle with as a state is about 1/3 of our population lives in fairly rural areas, and they may not have access to even primary care in their area. So this really improves access potentially for a lot of populations, particularly if they're seeking specialty care in the area of women's health, where we have multiple subspecialists here in the Medical University of South Carolina that aren't available in other areas of the state.
So in South Carolina, about 650,000 individuals do not have access to high-speed internet. And although the FCC has made a commitment over the next 10 years to dedicate over $120 million to provide broadband access in rural areas of South Carolina, the changes just aren't happening fast enough to serve women and to provide them the healthcare services that they need now, today. So my hope for the WISE Telehealth Network is that we will be able to provide infrastructure through the library so that women can access high-speed internet, they can have successful telehealth appointments, and they can receive the care that they need in their local community without having to travel far from their home to visit a clinic. My hope is that the WISE Telehealth Network will decrease health disparities and improve health outcomes among women in rural areas of our state. And ultimately, it is my hope that there will be a WISE at every rural library in South Carolina and beyond.